Everybody. We are here for our roundtable discussion on diabesity. Adults, children, this is really the next pandemic we're going to see. And with me today, as always, for our roundtable discussion is Jamie Dorley, CEO and owner of Nutritional Frontiers and the Weiner Wellness Center, and Joe Messino, the godfather of nutrition and clinic director.
There we go. Good afternoon, Dr.
All the way
Tracy.
around.
Good afternoon, Joe. Philly Phil, we got the whole crew here ready to go. And this is a topic that's very close to me. I've dealt with some of these issues before. And I think a lot of people, they don't think it's happening. They think sometimes it just happened today, right? Oh, I caught diabetes. I was looking up some research in preparation of this. And, when you look back, it's very insidious in nature. The average person, it takes 4 to 7 years from when they have it till it's diagnosed. So they may call that another one of the silent killers.
Yeah.
Because it's a slow, steady progression with somebody with type 2. The good news is we can help them. So maybe we just define what type 1, 2, and 3 are and pre-diabetes, because I think it's confusing to people.
It is, and I think that's why what you just said rings true. It's because before they get diabetes, they have to get into insulin resistance and pre-diabetes. And insulin resistance, I think, is probably one of the more misunderstood, levels or categories. So basically what that is there's multiple factors working here. One is the onslaught of sugar. That's where you always got to start. But, a lot of doctors that I've studied under say it's not the sugar, it's it's how much sugar.
It is the sugar.
It is. It's how much. And it's also your body's ability to process it.
Sure.
And that's where I think a lot of people miss the boat. They can't process it. And when you have that onslaught of sugar in your diet all the time, and from areas you don't know it's coming, people say, I don't add sugar to anything. You don't have to. It's already in there.
Yeah. And I think, there's 2 factors that come in with diabetes, 1, 2, and 3 even, is there's fat deficiency, because we have to remember insulin's a hormone. So it's the fat-free that kind of created the issue where we became fat deficient, because that serves all of our hormones and all of our hormone panels. And then there's a toxicity and inflammatory response with the added sugar. And I think, Jamie, that's where you're going to get into that diabetes type 3 and that impact on the brain. So why don't you define for us, Jamie, the different types, and so people have a better picture.
So basically how the body works is that your pancreas will produce insulin. Insulin's a hormone. Insulin's job is to tell the cells, it sends signals in there to open up and allow sugar in to be burned by the mitochondria, which is your fireplace or blast furnace.
Right.
So in a normal individual, like you and Tracy, you guys are normal, right?
Pretty much. Abby normal most of the time.
Exactly. Yeah. Abby normal. So in a normal individual and a healthy individual, you say you consume Power Cleanse, or you go to lunch, right? You have the food truck there. You eat whatever you're eating, and then your body will release a normal amount of insulin.
Right.
Insulin's going to tell the cells, open up,
right,
and let's get the sugar inside to be burned. Okay, that's in a normal individual. What happens, let's start with pre-diabetes, right? Insulin resistance pre-diabetes. What's happening there is a combination usually of too much sugar coming in. The body is producing more insulin, but it's still not enough. And your body becomes insulin resistant to insulin's action.
Right.
It's like the boy that cried wolf, right?
You also have another component, which is a mineral deficiency, because at the gatekeeper of that cell to open up to allow insulin to drive the glucose in are 2 primary minerals, chromium and vanadium. Yeah. And many people are deficient in those, James.
So you add in that factor. So the body becomes resistant to insulin's action. So the answer by the body is to do what? You produce more insulin.
Yes.
Right? Because you're thinking, hey, no one's listening. Let me hit that doorbell 100 times now because nobody's home. So it's a combination. Then you factor in the sedentary lifestyle. So that's pre-diabetes. One of the easiest, least expensive tests in the world to determine if somebody's pre-diabetic is simply get a tape measure out. As the waist circumference increases, you're higher risk or probably are pre-diabetic, right?
Right.
So that's pre-diabetes. What happens with type 1 diabetics is that the pancreas no longer produces insulin.
Right.
That's a lot trickier. It's more of an autoimmune type condition. And what happens there is that your body's not producing insulin, so you don't have the insulin to tell the cells to open up. That's one of the few cases where you need to have an external source of insulin. That drug can save your life, right? Then you have what they call actually a type 1.5. Have you guys heard this term?
1.5. Ooh, this sounds like some breaking news.
Almost there.
Almost there. It means you are dripping insulin. So it hasn't shut down 100%, but it's like the faucet that's got a little trickle. It's just coming out. Not enough to make a difference, but you're not technically a type 1.
Okay.
Type 2 is the much more common diabetes.
Yes.
Type 2 is where you are producing insulin, but it's still not enough because what's happening now is there's too much sugar. The body is overproducing insulin. You still can't get it inside the cell. Think about if you have a party at your house and 25 people show up at one time. They're not going to get through the front door in an orderly fashion. That's your type 2. And then type 3, which is a new term, is diabetes of the brain. So that's where the brain's on fire because sugar can act more like a rust or a corrosion to your cells. It sticks on the end of the nerves and becomes very toxic. It's hard, it's sticky, it's toxic. It actually erodes the nerve endings. That's why you see people, they may lose their tips of their fingers, they may lose their toes. Those situations are because poor circulation, toxicity to nerve ending, and now they have to have amputation, which is, a really serious issue. So type 3 diabetes is of the brain. That's what's leading to chronic issues such as dementia, Parkinson's, and Alzheimer's.
Right.
So you have pre-diabetes, type 1, which is the hardest one to help, even though lifestyle can help you reduce your insulin level and also have better cofactors, right? Then you have type 1.5, which is a little bit of insulin production. Type 2, you're producing insulin, not using it well. And type 3 is the inflammation of the brain.
And you don't just go from 0 to type 3.
No.
This is a progression over the years. If you are diagnosed with something called type 3, then you've been doing this is a lifestyle over the course of your life that has caused this. And you're on your road, like you said, to Parkinson's, dementia, and Alzheimer's.
Yeah, and a lot of people don't even realize they have it, right? They may be really hungry. They can't lose weight, right?
That's just part of getting old.
Is it?
That's what they say.
Well, when does that start?
Ah.
It can start really young.
In childhood now.
Yeah, that's what I mean, right? It starts young. So look, I know there's some genetic predispositions. However, lifestyle is the most important thing.
Yes.
Right?
Yeah.
So you need to manage this with your lifestyle therapies, just like we've been talking about all week and for the last 25, 30 years. So this is not a situation that it just started, but there's a lot of symptoms that lead up to it, right? Overeating, lack of exercise, right? You can have fatigue. You can have a lot of cravings, inability to lose weight. And as you progress down that model, some of the symptoms later will be excessive thirst or urination. And you know the original test for diabetes mellitus? I'm sure you don't do this, Tracy, anymore. This is an outdated test, but the doctor would drink the urine because diabetes mellitus is true. They would drink the urine and they would taste it and see if it was really sweet. Yeah, we don't do this test anymore, but this is true. I mean, I'm just teaching you guys a little history here today.
That's terrible. That's terrible history lesson. I'm grossed out.
All right.
But what else? So I just want to give you some statistics so people understand that this just isn't like a problem that affects some people. This is actually 13% of our entire population has some form of diabetes. And this is a crude estimate, and these numbers were in 2018. So 34.2 million people have type 2 or have diabetes in total. And of those 34.2 million, 34.1 million are type 2. So only 0.1 are type 1. And as we know statistically, type 2 diabetes has a 98% recovery rate with lifestyle. So there's 34.1 million people not choosing a healthy lifestyle. and are diagnosed with type 2. Isn't that interesting?
What would do you have the number on the amount of people that are in insulin resistance? Because I think that's a lot higher.
They've seen over 60 million.
Yeah. So these are from the CDC.
Oh, they're trustworthy.
You can trust them.
You can trust them.
Because they really report numbers accurately.
Yes.
Well, one good thing was last year no one died of diabetes or heart disease.
Yes, so right.
That was a good year for us. Yeah. But seriously, what happened, if you look at the numbers and you add up pre-diabetics and diabetics, it's about 100 million out of a 300 million population. So it's about a third of people.
That's a lot.
And it's only getting worse.
Yeah. Well, the undiagnosed is really the sad part of it. It's very scary. Because the percentage that they're estimating, let me see, laboratory criteria, percentage increased 7.3 million people are undiagnosed.
Yeah. So
that's a lot of
things
people.
You can do. One is focus on what you can do your lifestyle wise, right? But if you want testing to see where you're at, do the tape measure, right? Check your pants, right? Your belt. Is your belt getting tighter? Not a good sign, right? And that's a simple test to do. Also checking your body weight, looking at blood pressure, cardiovascular markers. You can get a glucometer now for, I don't know, they're giving away almost at Walmart, right? $20. Test your blood sugar, fasting blood sugars. People get too focused on the exact number. 70 to 200 should be your numbers, depending on if you're fasting or post-meal, right? If they're staying under 200, the more you're fasting, the lower it should be. Some people do a little better at 90 or 100, some a little better at 80. That's a snapshot. So that's like taking a picture to see what someone looks like. The more important number, the 3-month average, is the A1C. Right? Now, I'm not as concerned with the numbers today. I want to see is a pattern of events over time to see if that number is going up or down. Now, it's a little bit hard of a number to change. You might get a half a point drop or a point drop. It's not going to drop 3 points. It's okay. As long as it's going closer to under 7, preferably under 6, and around 5 would be ideal. But again, blood work and testing should be a graph where you take your test 3 months, 6 months, 9 months, 12 months. You go back a year, 2 years. And that way you can see, hey, which way am I going? Am I trending better or am I trending worse? So it's really important to consistently have some kind of testing done so that it doesn't become a huge problem without you addressing it.
And that's usually what happens. They wait until that big, massive life event happens, and then, oh, this came out of nowhere.
Well, why is that? We're living in a medical society that treats chronic disease with acute therapies.
That's for sure.
So people are waiting till they're really sick, and then they're going to do something. And hey, if you don't care, that's on you, right? That might be some people. I think a lot of people do care. And why not change your lifestyle now anyway, so that you don't succumb to something?
And there's other, avenues and repercussions. I mean, type 2 diabetes and heart disease, they're joined at the hip. They're one with the other. If you have one, you're going to have some level of the other, and there's just no two ways about it.
Yeah, most people don't die from quote-unquote diabetes. It's usually kidney failure, heart attack, or stroke, right? It's also the number one cause of blindness in our country, right? Diabetes of the eyes. My doctor told me about that. I about fell over, right? So diabetes of the eyes. He said, I just saw somebody, diabetes of the eyes. He says, you know what that's like? He was really upset. Good guy, right? He was really upset because he had a patient come in and the patient wouldn't listen over and over and over. The person wouldn't change their diet. And then they would start losing their sight. So, it's one of those things like Tracy would say is, I guess you're not sick enough, right?
It's not bad enough yet.
Yeah. When it's bad enough, you'll do something about it, right? And it's a shame.
You'll do anything. When it's bad enough, you'll do anything. You'll give up the Diet Coke. You'll give up the morning donuts. You'll do anything when it's bad enough. But it's sad that we have to get to that point, right?
Yeah, someone's commenting we were allopathic versus homeopathic. Look, there's a time and place for everything in the world. I think what happened is the order has been changed, right? So we're going to medication surgery first, and then when they really screw you up, then they're going to call Tracy or Joe and say, oh, can you help me? My colon's, I had a resection surgery and it came back in a new section, right? Or, hey, I need help with this infection now because I have diabetes uncontrolled for 5 years. Now I got a bad infection. So I'm not necessarily against allopathic. There's a time and place. It's been overprescribed and it's been prescribed out of order. All the national organizations, the NIH and the CDC, as bad as they are, they all recommend lifestyle therapies. The challenge is the allopathic doctor with third-party insurance reimbursement. They're not set up with the system to do natural therapies, to do homeopathy, to do lifestyle therapies, because the system does not reward them for that.
Right. And that's so frustrating because that the doctors want to take care of their patients. They're also not taught it. So right out of the gate, they go to medical school with these great intentions of helping people and helping people be well, and they're not taught the correct model. Then they're not rewarded for the correct model. And then, it just creates this cascade of sickness where medications start to cause other issues. And we've talked a little bit about the trifecta of medications that are prescribed for a diabetic. Can you touch on that a little bit, Joe?
It just seems weird that anytime, and you've probably seen this, Jamie, I mean, if someone has a level of diabetes or insulin resistance, they automatically put them on blood pressure and cholesterol medications.
Oh, yeah.
And it's like, oh, really? Oh, it's preventative. Oh, prevent heart disease. We know it's going to happen. It's going to come. But unfortunately, you're putting a Band-Aid on a wound that hasn't happened yet. And instead of just, preventing it from happening in the first place. I mean, there's so many factors. There are people, I saw somebody post something today, I got to bring this up, that they said, why would you ask what's in a vaccine if you don't ask what's in a McDonald's hamburger? And I couldn't resist, Tracy. I had to reply. I said, excuse me, but the person that's eating the McDonald's hamburger isn't the one questioning the vaccine, okay? It's the rest of us. But, that's just it. Nobody questions these ingredients. You've got all these things that we talked about earlier, these obesogens that people don't realize they're exposed to. Everything from the BPA in the plastic, the non-stick cookware, the baby bottles. They start them at that young an age on these plastic baby bottles, and God forbid you put it in the microwave. But these are all obesogens. And then the number one of all is high fructose corn syrup. It's everywhere. So, people may say, I don't add sugar, I don't do this, but you're eating it all day long in these packaged, preserved.
The hidden exposure. I think one of the things that Jamie and I had found out nonchalantly with a visit to one of our good friends who is a medical physician, who wants to do the right thing, who's kind of hamstringed by the insurance reimbursement, is that he has to prescribe a trifecta of medications with certain diagnoses, or he doesn't get his full reimbursement. And one of the things that, kind of shocked me was the fact that he's like, I'll prescribe it because I have to in order to get paid. But, when you get that prescription, you don't have to take it. So isn't that an interesting fact, Jamie? And, it's a sad model.
Yeah,
because it makes a difference, right? For someone that's running a $10 million practice, paying employees, that could be millions of dollars for every patient, that 34 million people.
Yeah, not only is it reimbursement, their medical license. Dr. Dean Silver, I used to work with in Florida, he would come to our events and he'd sit there and talk to the speaker at lunch, and we have a great conversation. And it says, Dr. Bob, he says, I am a cardiologist in the state of Florida. He says, the state law tells me that when someone has a heart attack, I have to put them on the big four, the cholesterol, the blood thinner, the blood pressure, right? And he says, what do I do? And Dr. Bob says, the fact that you're here at a functional medicine seminar tells me everything about you.
Right.
He says, I would recommend you follow the state law because your license will be in jeopardy. He says, however, it doesn't say you can't give them CoQ10 and the minerals and magnesium and those types of things. And that's what he did. He says, plus, I recommend a lifestyle therapy, which a lot of my colleagues do not. So one of it is reimbursement, 2 is their license, and 3 is their training. So a lot of you guys know, some may not know, but I do have type 1 diabetes, so I don't produce insulin. And my medical doctor every year tells me I need a flu shot and a pneumonia shot. So he looks at me and he says, I know, I got to tell you. I said, it's okay. So last year he had the medical student shadowing him in there, and he says, now look, he says, everybody that comes in with diabetes, he says, you flu shot, he says, pneumonia shot, blood pressure, and cholesterol drug. All right. And
along with the metformin.
Well, yeah, but no, those four are automatic.
Yeah, automatic.
He drilled it into this young lady's head that it was automatic. So what did she remember? Automatic. You put them on 4 no matter what. That doesn't include any blood sugar medications, right? And when I said to him that, hey, my blood pressure is good, which is surprising, as heavy as I've been at times, I've always had good blood pressure. He said, it's prevention. I said, what are we trying to prevent? He says, spillage of the protein into the urine, in the blood, because it's concerning for the kidneys, which is correct. I said, but there's other ways you can go about that. So I think a lot of it is that, this guy does have a good heart. He's in for the right reasons. His system and where he works is set up. So folks, you have to get the education and do what's best for you, right? Mm-hmm. But I knew losing weight, I knew working out, taking the glycolyze, the old sugar sop, doing the power, all those things would help, right? Being consistent with the exercise, checking the sugar, all those things are going to help you, because no medicine in the world is going to reverse this. No. Actually, it's the opposite.
Yes.
And that's really disappointing is when they're putting type 2 diabetics on insulin. Have you seen that, Tracy?
Oh, yeah.
Yes.
Yeah.
I've
That's
seen
terrible.
It, absolutely.
They don't, they get them hooked up with a dietitian or a nutritionist, which does such an archaic plan. When is the last time these nutrition schools updated this stuff?
You experienced that in
Hello, McFly.
I was there. I saw it. They were like, this is ridiculous.
The Journal of American Medical Association comes out every month, right? They come out with something and they talk about lifestyle. They talk about all the new studies. Are you all reading it? I don't think you are. Because honestly, Jamie, I don't think they got the edition, in 2002? It said that food isn't enough. So... And what do doctors say? Repeat that study and what doctors say about multis. Just go ahead.
Well, 2002, the Journal of American Medical Association, for the first time in 40 years, changed their position from eat right to eat right and take a multi. And the reason was that the incidence of chronic disease, the toxicity levels, and the nutrient deficiency of the standard American diet, they recommend everybody take a multi every day. Mm-hmm. The problem is they didn't tell which one to take, right? So Centrum and those types of cells went through the roof. But you need the vitamins and minerals. Joe had mentioned a couple of key minerals that are deficient. Magnesium, number 1 for diabetic or anybody. Vanadyl sulfate, right?
Yeah.
Chromium, alpha lipoic acid. These are all nutrients you get when you do power cleanse and something like glucolyze. Mm-hmm. So glucolyze is our natural version, quote unquote, of metformin. It helps make the body more sensitive to insulin's action, so you can open up those cells and drive nutrients through. Interesting enough, insulin does that. The nutrients in glycolyze do that. CLA does it, and exercise does it. So if you eat better,
snap.
Yeah. That's all the research showing. This PPAR, alpha, and gamma, basically they're the doormen of your cells. They will open up when you increase activity because the body's driving the nutrients in to be burned. But you mentioned RDs, and there are some great RDs out there. However, when I was getting some medical intervention a few years ago, Joe came by to hang out with me. And, the RD came in to give me dietary advice, right? And her recommendation, Tracy, was that vegetables don't count as carbs. There's no difference between
especially corn, potatoes, sweet. I'm just kidding.
French fries and ketchup, right?
Oh,
and there is no difference, she said, in carbohydrates. I said, what about? So she recommended, you ready?
I'm ready.
75 grams of carbs per meal.
Oh my gosh.
I said I would be dead in 500 pounds.
Joe, listen, your metformin bill would be optimal for reimbursement.
I barely do 75 grams in a whole day.
I know.
I really don't. Yeah. I eat vegetables and a little bit of fruit. Occasionally some carbs, but not every day. So when I looked at, Joe was like shaking his head. I said, 75 grams per meal. She says, oh yeah. I said, that'd be impossible.
Well, you have to also explain that she probably lived that lifestyle.
Yes.
Because she was
severely overweight.
She
was obese.
Obese as a hospital dietitian, right? So, you have the same problem with that as you have with, Larry the Cable Guy. So, they don't have the knowledge. And I mean, nutritionists and RDs are a different breed for the most part.
Yeah, there are some functional dietitians like Sheila Dean in Florida, but they're few and far between. Paulina, that type of people.
Yeah.
But Joe Schwartz has a great point. More weight training when it comes to improving insulin sensitivity.
That's right.
Absolutely. The more muscle you have, the more sensitivity you will have to insulin's actions and better use of the sugars because you're going to use them when you're training. The other part is that a lot of people determine like their body fat around, the subcutaneous.
Mm-hmm.
There's also intramuscular body fat, right?
Mm-hmm.
Which I found out, which was really scary because what happens is the organs and your muscles become insulin resistant. So now you are storing body fat intramuscularly. So you may not have a lot of stuff, quote unquote, hanging, but you don't have a lot of definition. That's because you have a lot of fat inside the muscles. And the scary one is when it's around the organs.
So that's like a sumo wrestler.
Yeah.
Right? That's
or somebody even with
type.
like the bigger gut. Yeah.
That's that body type.
Yeah. So great point. Another great reason for using exercise. I mean, I can go on. We can have a whole show on exercise. I was talking to two women yesterday. They're concerned they have osteopenia and they're young in their 50s. And I said to the woman, do you work out? She goes, oh, no. I says, and she looked like she did. I says, look, 2 days of weight training for 20 to 30 minutes will give the muscle and the bone stimulus to remodel.
Mm-hmm.
Without that, it's not going to work. And I also reminded her that, your body needs the activity to burn fat and to drive all the nutrients in, like we're talking about here.
And that's a perfect example.
Optimize
PSD. PSD. When you do resistance training, your bones benefit, not just your muscles.
Yeah. And when you do resistance training, or any type of exercise, you detox. There's so many benefits to exercise. And it doesn't even have to be structured for like an hour a day. It can be cumulative. Go for a walk in the morning for 10 minutes. Come back, do some push-ups and lunges in your office. Go out at lunch and walk. Like, we're meant to move all day long. We've become such a stagnant nation. And even in here, like in between, I'll go outside. I have weights right back there in my office. Like, I can't go for a structured hour to a gym, nor would I choose to because I don't like gyms anymore. But, a structured hour in my house, that doesn't happen with exercise for mommy. But I can go play with the kids. I can go outside and play sports and wiffle ball and do all that stuff too. So don't get in the mindset that it has to be like solid hour at one time.
It can be
Some
15,
people
20
love that.
minutes.
Yeah, absolutely. I follow this girl on YouTube and I love her. She does 15 to 20 minute workouts real quick. Sometimes it's cardio. Pamela Reif. That's her name, Reiff. She's great, and she's a great trainer. Quiet, very concise. You can pick what you want to do that day. She has thousands of videos, tremendous following. I enjoy her videos. I'll get on YouTube, and she doesn't talk. She's not one of those scream and motivate. She's kind of like exercising with a mind.
Let's go.
So I really like her.
Yeah.
Come on, Peloton. Yeah.
Yeah, exactly. I don't like that kind of stuff. I'm more like, just let me be in my own head. This is kind of like my moment. So she'll have music over her videos, and she's great. So her name's Pamela Reif. Oh, he's got it. Did you find that already? My goodness. Look at Phil. He's like super fast.
Super Phil.
Yeah, super Phil. So absolutely, movement's
there's
important.
Something else we should talk about, and this is what Jamie has really beaten this subject, but people need it beaten into them, and that's read your labels. My God, if people would just read the label of the majority of the things they buy in a supermarket.
Well, Joe, as we know, the food you're supposed to eat doesn't have labels.
That's for sure.
Right?
That's right.
So it's really simple. It may not always be easy. Do a shake for breakfast, right? Around lunchtime, have some kind of veggies, salad, and some lean protein. In the afternoon, you want to do a shake or snack. A handful of nuts would be great. And then dinner should be the same type of food. It's not really complicated. I think people get bored or they feel a little comfortable, lazy. I have this food in the closet I got to use up. I'm running late. I got to go to the fast food place. Folks, you have to invest with the food. If you're going to spend money on anything, spend it on good quality food. And when you get to your goal, and if you have a little treat every now and then, it's not a big deal, but it can't be the foundation of your diet. And, a lot of people seem like they don't really care, but I think deep down they do, right? Deep down, if they could be healthy, they would choose to be healthy.
Sure, they would. If they could choose. Anybody wants to be healthy. That was one of my dad's favorite sayings. Money spent on good food is never wasted.
Absolutely. That's what I said to my family. I says, cut back on the shoes or the type of car you drive or the jewelry, but you should invest in your food. That's the number one thing you should invest your money in, not a stock, but in your food. And look, there's plenty of places in Pittsburgh now. You got Whole Foods and you got the organic stores and everything. Sure. Buy the right types of food. And the caveat is buy for a couple of days.
Yeah. You
can't go grocery shopping for a week or 2 weeks with real live food. It's not going to last real long, right?
All right.
If you have all that.
I want to ask you a question, guys, because I want to get, I want to dig down into this because there's lots of things. I mean, I think, I think a lot of people really try lifestyle. I think they do. But I think the lifestyle programs that are out there, right, fail them. So we've had kind of like come up with the NF for Life. You've lectured on it a couple of times. But I want to ask some very poignant questions. One of the things that the CDC says is that insulin resistance and deficiency of fat-soluble vitamins, you are 2 times more likely to go into diabetes type 2 than people that aren't deficient. So what are the deficiencies of fat-soluble vitamins that are associated with insulin resistance that could lead to diabetes type 2? You get 5 minutes per question. Okay, go.
Oh, great. Well, the fat-soluble vitamins are A, D, E, and K.
Yep.
And I would have to think the number one deficiency would be vitamin D.
Ding, ding, ding.
Yeah, yep, vitamin D. And the one that most people don't know about is vitamin K, K2, because of the dietary sources that they're limited on. It only comes from grass-fed beef products because when a cow eats grass, that's K1. And then its digestive system ferments it into vitamin K2. So,
I think the reason the D is so important is that in a lot of new literature, they're terming vitamin D of a hormone-like substance, right? Because the ability to help with hormone balancing and remodeling, its ability to help with the immune system. There's so many factors involved with that. So I'd have to say vitamin D is the most important fat-soluble vitamin for anybody, especially diabetics.
So here's the reason. You ready? Specific receptors in the pancreas only switch on with sufficient levels of vitamin D. And those can be different for each person. So I know that we have the oligo scan, Joe, but this is what I mean. Like people may really try. They might go out and be like, okay, I'm going to, eat the right amount of fats and get my carbs under control. But like you said, Jamie, food's not enough. It's not enough with the nutrients that we need. They need to supplement. So what recommendation would you give them on the type of vitamin D that they need? Because there's D2, there's D3, right? We don't want to be toxic.
Yeah, I recommend
address all of those.
I recommend vitamin D3. I like the liquid. It's really simple. I drink it right out of a bottle, take a couple of droppers full. You can take that in even 4 or 5 days a week to get enough in. There you go. Yeah. And, I'm not concerned at all about taking too much because I know my body needs it. And I do get my blood levels tested. At one point, I was 39, and now I've gotten up into the 60s. So hopefully next time it's in the 70s. Optimal is over 80. Think about a test in school. I know you guys are straight A's, right? So you would have a score from 0 to 100. Vitamin D is 30 to 100. Just like in school, a 30 would be failing, right? You get about a 70 before you start passing. So same thing with vitamin D levels. Do not accept that 30 is normal.
No.
Right.
Okay? You need over 70 because we don't want normal. We want therapeutic levels.
Yeah, we want optimal.
I'm glad you confirmed that for me because my thoughts were it would help with hormone balancing. Now I know the receptor sites of the pancreas. So really good information.
Now, what I like to do is I like to combine the D3 liquid with the Super K2 Plus. So I get, some of my D from the K2 Plus. It has A, D, and K, K2, and then I add extra D with the liquid. So I get that's how I balance that.
Wow, that's awesome. So here's something from September 2019 in the European Journal of Endocrinology. They found that vitamin D supplementation for 6 months or more, improved insulin sensitivity, and the production also helped people stay away from the diagnosis of type 2 diabetes. So that's pretty valid. All right, here's your next question. Talk to me a little bit about I think these are real, right?
These are great.
So let's talk about food sensitivities and the onset of diabetes type 2. I think sometimes we think we're eating all the right foods, but we just can't get our blood sugar to balance.
I think she's talking to me again, Joe. So
are you talking to me? I'm talking
to you.
Well, I like good stories.
All right. This is a good one because for years, my son will attest to my family. My food was the same as when I did bodybuilding and lived on my own, poor guy in my early 20s. I would eat pretty much eggs and oatmeal. I would eat tuna fish and rice and chicken and baked potatoes, right? And the tuna fish used to be $3 for $1, so I'd go in there and load up the cart and buy as much as I could. I'd buy the oatmeal at the Amish store. So it was a very limited budget. I can eat fairly healthy. So here we are, fast forward 30 years later. I did the food allergy test, and Dr. Brazili is like, wow, 36 things. I was like, 36? She goes, yeah, do you eat eggs? I says, every day. Do you eat oatmeal? Yes. Tuna fish? Yes. She goes, every nut and nut butter in the world. So it started clicking. I showed it to my son, Zach, and he says, that's all the stuff you eat every day.
Yeah.
So what happened is my body was different at late 40s as it was at 20, right? Mm-hmm. Your body changes. Your diet has to evolve over time. So for me, it was a lot of food sensitivities from the things I was eating every day, even lettuce, because I would do a couple salads a day. So what I did was I adjusted my diet for about 6 months and eliminated a lot of these things, really strict for about 3 or 4, and then slowly started introducing some things I still don't eat. I try and stay away from breads and pastas and rice and things like that, any kind of baked goods. And that's that starch, right? That's that starch. Right. It's really difficult, especially for people that have a higher risk, a little more prone to being overweight. So food sensitivities was a big part of my program. And even though I thought about it before, I wasn't even sure. The second part of the story is when I went to go work for this huge company in our field, they promoted soy protein.
Yeah.
Right?
Yeah.
And I was like, well, hold on a minute. I said, soy, we would never consume that in bodybuilding. Oh, no, this is different. This is, pristine soy isolate, yada, 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 right? So I did 2 scoops of that twice a day for my program. And I watched as my body weight, you saw the pictures earlier, Tracy, my body weight just went like this.
The Puff Daddy thing. That was hilarious. Like with the picture. I was dying laughing when you're like, my kids referred to me as Puff Daddy at that time. I was like, oh my.
Where the
Sid was responsible for that. That was Sydney.
Yeah. But no, the food allergy is a big component. So soy protein shut my thyroid down. And Dr. Klein helped me the first time, right? That's when I started losing the weight initially, was he helped my thyroid to get clean because my thyroid was toxic from soy. So if you're a vegetarian, if you eat tofu and soy nuts and all this stuff, you better be careful because that can shut the thyroid down. So food allergies is a big component of this.
Yes, and sensitivities are probably even worse because they trigger other chemical issues in the body. It's not a full-blown anaphylactic shock like an allergy could be, but it triggers these other things. Now, I have another example of just what you talked about. One of my nephews, he was consuming soy protein shakes every day, multiple ones. Buying them, he lived up in New York. He was buying them at any, store he could get. Cheaper the better. Working out, lifting, but he was so puffy. And then he started losing his hair at 18 years old. Well, at 18.
Yeah.
You didn't lose it at 18.
No.
He started losing it at 18 due to the imbalance of all that soy protein. Terrible.
Yeah, Dr. David Klein, medical doctor in Florida, he was instrumental in getting me to really understand that deeply. And his thing was, I don't give a blank where it's coming from. Soy protein is soy protein. He says really
Right.
bad. He said soy's in a lot of things too. So he would do this test in his office. He would take your thermometer, test, right? Take your temperature test. And he says, if the thyroid's losing function, your temperature will drop, right? So he would give you a creamer, the soy-laden creamers, and he'd retest you, and your temperature would always come down a little bit. He said that's how quickly and toxic those things are. So, folks, soy is loaded in a lot of products under a lot of different names. It's not healthy for you. I don't care what name they use it under.
Right. And sensitivities can be stress to the body. That's really what we're talking about, is this cascade of stress and cortisol production. And cortisol raises blood sugar. It just does. That's the point to it. You want more energy in the time of stress. So your body's going to push blood sugar into the blood so that your cells have enough energy to run in that fight or flight. So when you're talking about this, I mean, it could be pain. People that have more pain have higher blood sugar. People have more stress in their life have higher blood sugar. So all of these things are stress. It doesn't matter what it is. And sensitivities to foods like you had, and like we all have, can cause stress and high cortisol levels. Okay, this is good. Do you have anything else to add to that before I ask my other question?
No, 5 minutes is up.
Yep.
All right. Okay. So I want to talk a little bit about high yeast or candida and blood sugar issues. So address that a little bit.
Well, when you have candida issues, that's an overgrowth of fungus, which is directly related to sugar. Right. So it's all about it. Now, what I learned, I years ago used to think that all candida was bad, but it's not. I learned that from Dr. Tracy, that you have to have a balance. You need some candida in your body. But unfortunately, like just about everything else in this country, the overgrowth of candida is, off the charts. And it's all due to the added sugars in all the foods that people are consuming. They don't realize how much is in there, and it's daily with these sugars. So the candida overgrowth then becomes a direct relation to that. Now, another thing a lot of people think is men can't have yeast infections. Well, of course they can.
Why can't they?
Well, that's a female thing.
Well, you don't need a vagina to have a yeast infection. You can have them anywhere.
I knew if I set him up,
he couldn't help himself. So here's what I learned, and actually Jamie and I walked through this together. Most diabetics have a hard time controlling their blood sugar. So what that does is it allows sugar to be released into the system that's not pushed into cells, is not utilized. And that natural barrier of candida that we have in our bodies actually starts to eat it, becomes bigger, becomes systemic, and then it's everywhere. And a lot of diabetics, they actually deal with things like thrush a lot. They deal with vaginal yeast infections, toe fungus, right? I mean, all of that is overgrowth of yeast. I think the bigger thing, Jamie, is the secondary infections that we can get, of the candida and the overgrowth. Can you address that and maybe candy kill?
Absolutely, yeah. And I've experienced all these, of course. And, starting out with psoriasis way back in my early 20s, I was probably 19 and couldn't figure out what was causing it. And I learned over time it's toxicity and candida, right? And the candida, another part of this, Tracy, is that I think that's responsible for a lot of people's mood disturbances and their cravings, right? When that candida is acting up, it wants to be fed. And that's where a lot of people are struggling. So what I've noticed is when I do the Candy Kill, that really helps. My skin's clear 100% now, no psoriasis. It actually reduces my cravings for anything. Last night I was like, I'm not even craving anything, right? So I went back on the Candy Kill because when I went on vacation and slid a little bit on the diet for a couple of weeks, I can tell I wasn't feeling as good. So the Candida will promote those cravings. So the Candy Kill by Nutritional Frontiers will help kill off the Candida. So we like to kill it with the Candy Kill, starve it with the diet, eliminating dairy and sugar, and then replace it with something like Superbiotics or SBC. I do better on the Superbiotics.
And the SBC helps in eliminating it as well out of the body. So,
but the part with the infection is that I feel that the Candy Kill will kill off any of the bacteria that may be responsible. and it builds up the good bacteria, so you're not as prone to any type of infections. But that's something, folks, you do not want to deal with that. So you need to get the Candida kill, get the Candida under control, and get those blood sugars balanced. No joke.
Yeah, absolutely. And I think the berberine that is in the Candy Kill is fabulous for blood sugar and helping balance blood sugar. And there is a therapeutic dose in there. You also have the oregano, you have the thyme that are antimicrobial, antibacterial, antifungal. So they all work in conjunction. And the caprylic acid is really what goes after the yeast. And when you back it with a good probiotic like SBC, Saccharomyces boulardii, or superbiotics, you're repopulating that digestive system. You're putting in more soldiers to go against any candida that might try to come back. The last thing I want to talk about is the connection between candida and heavy metals, and how some heavy metal toxicity can actually stimulate type 1 or type 2 or even type 3 diabetes. Joe, I'm going to let you take that, the connection between those two.
Well, you have some metals that are so abundant in our food supply and in our water that I think that's where we're running into the most problem. And I'll tell you about one, cadmium. And cadmium is not something everybody would think about right off the bat when they think about heavy metal toxicity. But it's in vegetables, it's in anything grown in the ground. It's especially abundant in brown rice. And people think, oh, brown rice is healthier than white rice, right? Well, it's loaded with cadmium. And cadmium is a disruptor. It's going to disrupt the endocrine system, which, of course, insulin is a part of. So it can all be related to that. And then on top of that, you add the big three, fluoride, chromide, and bromide. And those are abundant in our lifestyle as well. Fluorine in the water and toothpaste, chlorine in the water, and bromide in all the baked goods that are out there. It replaced iodine many years ago.
I think what happens with the heavy metals, they congest the body's ability to detoxify, the body's ability to break down the candida and kill it off. Right. So when these metals are entrapped in the same type of cells, it makes it very challenging for the person to be able to do this. That's why you need a full approach with a Candida Kill, maybe a Live Clear or a Power Cleanse. And that's why those work so well together.
Mm-hmm.
Yeah, absolutely. And I know through some, experience that I've had with clients, not just with diabetics, but just clients in general that have reoccurring candida, that it's usually an underlying heavy metal issue. And we need to address those metals as well. So guys, just know that, when and I'm talking to the audience in general, it's like, we know that you're trying. There's so many facets that can come in, and you might be doing all the right things, but it just takes another set of eyes on it to be like, hey, let's change this. Or you might have food sensitivities, or you might need a different supplement. And so that's why we recommend that you work with a practitioner at the Weiner Wellness Center to get that plan in place. It's not easy to navigate all these things. And it can be very expensive if you don't have a plan that's directed, because then you're guessing.
Yeah, I think the last part we should address just for the last minute or two is the expectation, right?
Yeah.
So I think when people go into, meet with a personal trainer or a weight loss program or a natural healthcare professional, they expect everything that they've been dealing with to go away in a day, a week, or a month. And they expect to go back to their old lifestyle and be okay, right? So I think what happens is they're disappointed because that expectation isn't being met. So the expectation going in is, I always tell people, give it 4 months, no matter what you're doing. 1 month for you to see a difference, second month for your family, third month for a stranger, right? So you got to give it time, and then you got to be committed to doing this long term. You didn't get there overnight. It's not going to reverse overnight. You got to be patient. I was working with somebody recently, and I only lost 3 or 4 pounds. It's the first month, and how long you didn't gain weight.
Right.
I said, look at your skin improving, your energy levels up, you're sleeping again. Like, all these factors are falling into place. So I think the expectation has to be, I'm going to do this today, and then I'm going to repeat it 1,000 times, and then see what happens. Right. Even when I was making my comeback, I said, I'm going to give it really a good 2 years, right? Let me give myself 2 years. Now, I want results right away, but you want to get to these levels every couple of months, and then your goals will change, because what's between your goals and your accomplishments is really two things: discipline and consistency. You got to be able to do it today, and then you got to duplicate it every day.
Give yourself a good month for every year it took you to get there.
That's right.
That's a good barometer.
And that really comes with, expectations set by the practitioner too, that this isn't really like a destination game. I mean, Jamie, as much as you've improved your health over the last year and a half.
I got a bunch of new goals now. Yeah,
exactly. Like you should always have new goals for your health, and they should be preventative goals, because we're always fighting against something that's going to kill us. We all end up in the same place, and life's a terminal illness. It just depends on what you die from. So, and that's really the truth. Do you want to die from a ripe old age and you had a great quality of life, or do you want to die from cardiovascular disease? That's really what it comes down to. So increase in muscle.
Positive again. Yeah.
I'm misrealistic. I don't need to be positive. So positivity is a self thing. It doesn't come from me. But anyway, just like joy. So guys, when you embrace any of these programs, the NF for Life, Shake a Day Club that Jamie's been talking about over and over again, the supplements that you take, the 90% of your success comes from 90% of your participation in it. So you have to be all in. If you're not all in and you're not trying to do all the right things, and if you're struggling, make an appointment. The investment is worth it, because you will pay for your health one way or the other, either as an investment or an expense.
Pay me later.
That's right. Well, thank you guys for playing along.
Oh, we love playing along. There's a lot of joy and pain on this call. So
that's right. Pump it up.
And always a few surprises.
Can't get one past this, which is good.
I know. That's how Jamie and I communicate. Movie quotes or music lyrics. That's how it is. Well, thank you,
thanks,
guys.
Dr. Tracy. Thanks, Phil. Thanks, Joe. Thanks, everyone. Have a great day. God bless.
All right, guys. Thanks, everybody, for tuning in to the Weiner Wellness Virtual Summit today. Tune in tomorrow at 8:30 as we have an entire day of education planned for you. Don't forget to place your orders, call in, stop in, go see somebody there, make an appointment. You will not be sorry, and your health is worth it.